Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A physical therapist working in a high school setting has an athlete come into the treatment room complaining of a headache, fever, and a painful neck. The therapist positions the athlete in supine and flexes the hip to 90 degrees. When the therapist attempts to extend the knee in this position, the patient complains of significant pain. Which finding is most consistent with this scenario? Option 1, positive Kernig sign. Option 2, negative Kernig sign. Option 3, positive Brudzinski sign. Option 4, negative Brudzinski sign. The athlete is presenting with signs and symptoms of meningitis, which can be fatal if not diagnosed immediately. Let's explore meningitis as a medical condition. Meningitis refers to the inflammation of the meninges of the brain and spinal cord and can occur through viral or bacterial forms. A lumbar puncture, spinal tap, is the most definitive test for diagnosing meningitis since it allows for the analysis of cerebrospinal fluid. Blood tests can also be useful to identify the presence of infection and differentiate between bacterial and viral meningitis. Physical examination procedures such as Kernig's and Brudzinski sign can be used to assess for meningeal irritation. Let's explore each of the options. Option 1, positive Kernig sign. A positive Kernig sign is characterized by pain that is present when a patient is positioned in supine and cannot tolerate a combination of passive hip flexion and knee extension. This description is consistent with the information presented in the question. The pain results from inflammation of the meninges within the spinal cord. Kernig sign is a common screening tool used when meningitis is suspected. Option 2, negative Kernig sign. A negative Kernig sign is characterized by the absence of pain when positioned in supine with a combination of passive hip flexion and knee extension. Regardless of the presence or absence of Kernig sign, the therapist should contact the physician given the patient's current clinical presentation. Option 3, positive Brudzinski sign. A positive Brudzinski sign occurs when a patient placed in supine experiences pain with passive flexion of the neck. Passive neck flexion will also produce hip and knee flexion since the patient attempts to decrease neural tension caused by the progression of inflammation within the meninges. Brudzinski sign is a common screening tool used when meningitis is suspected. Option 4, negative Brudzinski sign. A negative Brudzinski sign occurs when a patient does not feel any pain or does not exhibit hip and knee flexion with passive flexion of the neck while positioned in supine. Regardless of the presence or absence of Brudzinski sign, the therapist should contact the physician given the patient's current clinical presentation. The correct answer is option 1. Let's explore the all-student data. 58% of students selected option 1, positive Kernig sign, the correct response. 2% of students selected option 2, negative Kernig sign. 38% of students selected option 3, positive Brudzinski sign. 2% of students selected option 4, negative Brudzinski sign. System classification. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. Content outline classification. This question is a foundations for evaluation, differential diagnosis, and prognosis question, which represents approximately 33% of all exam items. Level classification. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Thanks for joining us on the Score Builder's question and answer video session. See you next week.